Okay, I'm ready.
Well, everyone, welcome back to a very exciting episode of the Storybox podcast. Today, my friends, I'm delighted to welcome the plant-powered doctor, otherwise known as Dr. Gemma Newman. Now, for those of you that don't know who she is, I highly encourage you to go and research her because her work is fascinating and it's incredible at the same time. And she is multifaceted in a lot of different areas and topics that I'm very interested in and trying to learn more about. These are such as pediatrics, endocrinology, urology, vascular surgery, rehabilitation medicine, general practice, psychiatry. Those are just a few that are, and there's a lot more of them. She's also a Reiki master, or she's Reiki practices in the purposes of pain, healing, that is, and she's a best-selling author. She has a book called The Plant-Powered Doctor, a simple prescription for a healthier you. You can go and get a copy of that wherever books are sold. Dr. Gemma, can I welcome you so much to the Storybox podcast today?
Thank you so much, Jay. What a lovely introduction. I'm so happy to be here with you.
I'm so grateful for your time. Now, for my audience, you have stayed up really late. For people, I don't know how you're still awake because I would be fast asleep by now, but thank you so much for staying up. I am very much looking forward to this conversation with you. The very first question that I have for you, though, is a question that I love starting off with all my guests. It is, what does success look like for you?
Oh, success for me is about connection with people. I think as a child, well, maybe we all do this. I think we all wonder what we're going to do when we grow up. You know, what we're going to be? And people always ask us that question. And I think for me, from a very young age, it was really important to want to help people. I knew that from a young age. I thought, well, how do I help people? And then I try and think, well, why did I want to help people so much? And I think it was really around the concept of connection. I loved feeling useful. I was often the person people would call upon for help or for a listening ear, and that gave me a feeling of I guess maybe some validation if I look at it more deeply. And it's something that I really enjoyed. And there's nothing better than helping someone feel better. I can't think of anything better than that. So for me, it's about connection. And what I realized through my practice was that I really enjoy seeing my patients and connecting with them. But there's a whole world out there of people who are looking for health information and somewhere to turn. And I think a lot of the times modern medicine fails to provide that. So that's been something that's been an additional part of my mission over the last few years.
You look more into the holistic side of the individual as well, don't you?
Yes, I think, well, that's always the root of most issues. I think most of the things I see in my clinic are potentially as a result of the way we live in the Western world, how the environment that we are in, our food environment, our emotional environment, and I think, a lot of the things that we suffer from would be alleviated if we had a good listening ear, nutritious food, great sleeping patterns, connection with other humans and the environment and the planet.
I totally agree with you. You've been a doctor for 18 something years now, I believe. And I'm curious, throughout your time as a doctor in the world of connection and trying to help people with a vast majority of different health conditions, especially in the Western world as well, have you noticed that our health and our ability to connect with people has gotten better or gotten worse, you think?
Well, it's a really good question. And it's one that's hard to answer because I can only speak from experience. But what I discovered early on in my career was, there are always going to be people that fall unwell and that need your help as a doctor. I'm never going to be out of a job, that's for sure. But I think what I've noticed is that certainly in the new world where we have a lot more stimulation, we have a lot more computer connection rather than real life connection, I've seen an increase in loneliness and I haven't read any research into that, but I feel instinctively that it's true, especially with my patients in the last couple of years. But before that, there's an increase in loneliness and self-harm, especially in the younger generation. And this is something that really troubles me. If we're going to be looking at sort of trends over the years, I think certainly that has been increasing and on the rise.
Does diet contribute to that at all? Like the kind of foods we do eat?
Absolutely. Diet can have a really powerful impact on our mood, actually. It's obviously not going to be the only thing, but there are a number of really interesting trials that are coming forward. There was the most famous one I could think of is the SMILES trial by Felicia Jacka and her team, where they compared a Mediterranean style of eating with social support for patients that were suffering from depression. And they found that in the cohort of people that were given healthy diet advice, they actually had a remission of their depression symptoms. I think, I can't remember the stats now, but I think it was around about 1 in 4 versus around 8% for the social support group. So, that's a big difference between sort of 25% and 8%. And there are other studies to show that as well. There's a huge emerging field in psychiatry around the idea of psychobiotics, which are the microbes that are within our bodies that can help to modulate our mood. And we know that there are huge connections between the gut and the brain. There are far more signals being sent from the gut to the brain than the other way around. And they've got lots of ways of communicating. We've got the vagus nerve, which is the wandering nerve. It runs all the way from the medulla oblongata at the top of the body and the brain stem right down into the gut via the diaphragm. And we have the immune system that interacts between the brain and the gut. 70% of our immune cells reside by the gut wall. So obviously the foods that we eat have a tremendous role to play in either activating or soothing that immune response. And then, of course, we've got those little microbes, that entire new invisible organ that we've discovered has such relevance over the last sort of 5 to 10 years, and how that can impact our mood in numerous ways. It definitely can. And with my patients, I certainly give them top tips around eating more unprocessed foods, more whole foods, more plants, of course, those polyphenols, phytonutrients, antioxidant-rich foods, the fruits, the veggies, whole grains, beans, lentils, chickpeas, oats, herbs, spices, nuts, seeds, tofu, tempeh, all these amazing foods that will help to nourish our mind as well as our gut.
I want to come back to more plant-powered predominant foods, hormones in just a moment, but I want to give my audience a little bit of background of your story and why you decided to become a doctor. And you've studied in many, many different fields, as I mentioned in the introduction for people. They can go and re-listen to it. But why did you jump around from different, area of expertise?
So for me, it was all about increasing the breadth of knowledge. And I wanted to be able to be a good family physician. And in order to do that well, you have to know the basics of a lot of different things. And so that was really why I thought, I've got to do a bit more of a dive into a variety of topics, because if I've got somebody that's turning up and sitting in front of me, they could literally come with absolutely anything. And so I need a fairly good grounding in knowing what the different specialties offer, knowing all the different kinds of ailments that people can suffer from, knowing the most standard treatments, knowing the guidelines for those treatments, so that I could advise my patients and also share that journey with them, because they would often find, even if they did have a symptom or a problem, then they were referred to a specialist for an intervention of some sort, an operation or a procedure. They obviously didn't necessarily even understand what was going on because it wasn't explained to them. So I needed to be able to know exactly what to tell them about what was going to happen. So yeah, it was a nice exploration into a number of different specialties, but also some of the things were of particular interest. I really enjoyed my obstetrics, my gynaecology, pediatrics, psychiatry. These are areas that I found really deeply fascinating, and was tempted to go into each of them when I worked in those areas. But in the end, I my heart always came back to general practice, because I just love the idea of getting to know families from cradle to grave and following their progress over generations and saving lives in slow motion. So yeah, that was always it for me.
I like that, because knowledge is power, right? And the more knowledge you have as a doctor, the better it is, because you're not going to be seeing just one person coming in with one particular illness. You're going to have someone coming in with a vast majority of different illnesses, and you're seeing many different patients on any given day. And also having a holistic approach to it too is also another added benefit, because there's not many doctors in the Western world, here in Australia that is, that have a more Western. We have what they call naturopaths here. I don't know if you have them in the UK, but they basically look at the holistic side of things. I was a bit skeptical at first going to one, to be honest, but they actually helped my gut problems, and it's a whole story, Gemma. I won't get into it. I won't bore you with it. But
it wouldn't bore me, but
it's wild. It's outrageous. But I did it to myself. But anyway, that's neither here or there. Maybe another time I might share it with you. But I guess I wanted to ask you, moving into sort of the Reiki side of things, and meditation, because I know you're interested in those two things. What made you interested in being a Reiki teacher or master, that sort of thing?
Oh, that's a good question as well. I think for me, when I go back to my core understanding of what it means to be human, I come back to the connection piece that we touched upon when you first asked me what success means to me. Yeah. And what I began to realize was that for many of my patients, it was the therapeutic relationship that helped to build trust, and that helped to build, foster the idea that they could actually begin to help themselves in ways that they hadn't necessarily realized before. And when you look at scientific research and you understand that in many trials, they have to take note of the placebo effect and the way that the body is able to heal itself because the person believes that they are going to be made better. And it's actually quite a dramatic effect. So it can be really quite marked when you do a clinical trial, how strong the placebo effect is. And normally it's just kind of discounted. People say, oh, well, yeah, we've got to exclude, that improvement of 20%, say, because that was just the placebo effect. But if you delve into that a little bit deeper, I think it's an incredible thing that, the power of intention and the power of perception has allowed you to have a different kind of relationship with your body than you had before, and has allowed symptoms that you may have experienced to improve. And so I felt as though I didn't have a complete understanding as to why I felt energetic medicine could be helpful, but I was curious. I wanted to learn more. And so I studied Western style Reiki and I studied Jikiden style Reiki, which are two different disciplines. And I began to see the crossover between them, as well as the crossover between other modalities of energetic healing. And what I began to realize was that there are a number of ways in which we can help ourselves towards healing that we haven't really as yet been able to explain using the scientific method. And I have my own theories as to why it works, which haven't been externally validated. But even if I just stick to the studies that have, I can see that there are some benefits to experiencing Reiki for the purposes of pain relief. There are a number of well-renowned cancer centers that now offer Reiki healing for their clients and patients who are experiencing cancer and want to have some complementary therapies to improve their emotional outcomes, their pain relief. There are studies on back pain relief and Reiki. There are studies on people with, I think, IV disc herniation, nausea, and side effects from chemotherapy, for example. So, there are some definite studies to show that it's helpful, studies to show that it can be as helpful as other complementary therapies, or even physical therapies. There was one study that showed it had a similar efficacy for pain relief as a course of physiotherapy, but ended up being significantly cheaper to run. So, there are some definite benefits that we can see. And that's what really fascinated me when I began to study this. And I very much enjoyed including it as part of my practice.
What does the practice include for those people that don't know?
So it depends on which type you are having, but the one that I tend to favor is Jikiden Reiki, and it's essentially a hands-on practice. So what you would experience in a room is a brief sort of questionnaire of what your issues are, and then I like to repeat the mantra that I was taught as part of my daily practice, and then simply it's a hands-on treatment. So I can't go into the details of exactly what happens because that would break my Reiki training. But for the person who's experiencing it, they would basically experience hands-on therapy in various areas of the body, and they may then enjoy a sort of a brief massage at the end, clothes on. Again, it's just a hands-on therapy.
Yeah. So basically, energy, connection, that sort of thing. Yeah,
that sort of thing. And yeah, I do. I have explained it once before, actually. Quite recently, I was with a friend chatting about this, and he invited me onto his podcast. I don't know if you know him. He's called Nimai Delgado, and he was asking. He's an engineer and a bodybuilder, and he wants to know what my theories were as to why Reiki has some health benefits. And so I explained to him as best I could my own meandering thoughts on the power of intention and how you can meld them together in an understanding of Reiki. He got it, but it was it's just my theory. So I feel as though it's not something that I can share as to this is why it works, because we haven't really discovered exactly why yet. It's one of the mysteries of science.
No, I like it. I think it is very fascinating, and because I haven't done it myself, I haven't had the practice of that before, but I do have a friend of mine in the States that she's a Reiki practitioner as well. So I think when I get over there, she's promised that she'll do one with me. So hopefully that I get more adverse to what goes on in it, because I got quite a few pain areas in my body. So maybe we can release those. But I guess moving the conversation from Reiki to more another area of interest for me, which is hormones and hormone regulation. And I know you've spoken with Rich and Simon, some of my friends, about hormone regulations for women. You've dove further into that. So I highly encourage people to go and listen to those ones. But firstly, what are hormones for people? Why do we have them? And how do we fix a broken hormone? I know there's 3 questions in there.
So, hormones are instrumental to not only our physical health, but our mental health and our development as well. Essentially, they're chemical messengers that our bodies use to help us to regulate our body's functions. And there's over 50 different types, and they can be produced in various parts of the body. So you could have the thyroid hormone produced by the thyroid gland. In females, we tend to have the ovaries produced estrogen. In males, we tend to have the testicles produced testosterone. There's obviously very basic, but you have many different endocrine organs or hormone organs. The pancreas, that's where the insulin that our body uses is released, and they all have to work together in synergy, and it's like an orchestra. And it all kind of works amazingly when the conductor is having a great day and everybody's watching and everybody's experienced, and they're all just kind of having a fantastic musical symphony. But then, if you're having a bad day, maybe the bassist is off, or the violinist is kind of a bit screechy, then the whole thing can kind of turn on its head, and you can get a cacophony of noise. It's a bit like that with hormones. Like, they have to all work together in very sort of tight feedback mechanisms. And usually that's controlled by the brain or the hypothalamic pituitary axis. So you've got this constant feedback mechanism, say how much hormone is being produced here, is that enough, do we need more, do we need less, and it's a feedback kind of loop. So it's quite intricate, it's quite complicated, and it can be affected by the way that we live. It can be affected by, in part, by the things like the food that we eat, the amount of sleep that we get, the amount of movement we experience in our bodies, the amount of stress that we have. And these are all things that can play a part in our hormone regulation as well as our environment.
Are hormones different for males and females?
Yes, I think there is a difference. Hormones regulate when we go through puberty, and when females will experience menopause, and they also regulate how our bodies go through puberty. So you know that if you have more estrogen, it tends to have a feminizing effect. There'll be increased fat storage. Whereas with men with more testosterone, you may have increased muscle, lowering of the voice. There's a number of ways in which hormones can change based on the sex that you were assigned at birth, and how those hormones start to interact in the puberty years. And also, in our reproductive lives, I think women are very much affected by the cycle between estrogen, progesterone, and the menstrual cycle, our monthly cycles throughout our reproductive years. And then, of course, the sudden drop and the sudden highs and lows of estrogen that we experience in the perimenopause, leading then into the menopause, where we will experience a drop in the amount of estrogen that our bodies are producing from our ovaries, and more dramatic symptoms than perhaps a man would experience at that time, which is a more gradual decline in testosterone levels.
So we can say that for some men that might have what they call man boobs, that is a result of hormones, a hormone imbalance?
You could say that, because interestingly, our fat cells, some of them at least, are actually hormonally active. They're not just inert in our bodies. They have kind of hormone releasing potential. And so, in fact, that's why when women go through menopause, for example, there's a tendency to then shift in where our body weight is, because our bodies are very clever, and they want to continue to experience the estrogen that we were having before. So if the ovaries are beginning to shut down, then they'll hold on to the fat cells that are producing estrogen, which is why it's more common for fat distribution to be more around the belly for women around and after menopause than before. And with men, again, if there's higher levels of fat in the body, then you have higher levels of endogenous estrogen production from the fat cells, which can then lead to so-called man boobs. It is in relation to a hormonal imbalance, I think.
Because, I'll just be honest and vulnerable here for a second. And for those people that know me in person, like, I'm constantly teased about this. I'm fairly active, and doesn't matter how many push-ups or chest exercises I do, I still can't get rid of the extra, I guess, layer. So my chest is a lot bigger than some of my mates are, and they technically, they tend to tease me about it. They're like, "So Jay, you still got your man boobs and all that sort of stuff." Yeah, it's quite. And it's been one of those things for me where I've been trying to get rid of it for such a long time. But then I thought about what I used to eat growing up that might have affected the hormonal imbalance, that might have contributed to the extra fat stores. Because everywhere else in my body, I'm fine. Like, I've got barely any fat anywhere else. It just seems to be in the chest area. It was me drinking a ton of cow's milk and all that stuff growing up. And I'm curious, like, what is it about drinking, I guess, a lot of dairy or having a lot of dairy in your diet that contributes to the hormones and all that sort of stuff? That question made sense.
Well, yeah, no, that does make sense. But I think it's a more complex question, because there are lots of reasons for so-called man boobs, and it doesn't necessarily relate just to diet. So obviously you would have had this investigated, I'm sure, over the course of the years. But if you had a more severe case, then you'd be looking into certain medications, for example, that might have caused it, like steroid medications or alcohol or opioids, or sometimes reflux medications, antipsychotics, and certain alkalizing agents. So there's quite a lot of different drugs that can potentially contribute to what we call gynecomastia, which is the sort of man boob phenomenon. But yeah, it's not just necessarily that simple. So you should definitely, if anyone out there has got man boobs and they're worried about them, then go to your doctor first up, because there are a few tests and investigations that you should do just to rule out some obvious causes. But failing that, then yes, I suppose there could well be a link there if you've had a lot of dairy, because again, this is anecdotal from my perspective, but when you are drinking cow's milk, you're essentially also drinking bioequivalent estrogen from the cow, because the cow has been pregnant and is lactating, obviously, and so that is the breast milk from the cow. And many of the cows in the dairy industry are pregnant at the time at which they are lactating as well, sort of pregnant with their next calf. So there is probably quite a lot of estrogen circulating within that mammal. And then, I can postulate that it would then be potentially in their milk, certainly a lot more bioequivalent estrogen than you would expect from soy milk, for example, which has phytoestrogens, which are very different and are not associated with gynecomastia.
I don't drink, smoke, take steroids, anything like that, but I do have reflux medication, which I immediately perked me up. But I've had this thing for most of my life. I don't think I've ever been on reflux medication, but I'll tell you a quick funny story. I did go and see a specialist. I forgot the area of expertise that he was in. And he did a full body examination, and I'm lying on the table and I got my shirt off, and he's like looking at my body and pointing and feeling at different areas to see if I got pain in different areas. And then he decides to grab my breast area, and he starts squeezing it, and he goes, this feels a little bit bigger than the other one. Like I think he was looking for breast cancer or something. And he goes, you're a man, you shouldn't have big breasts. And I'm like, feeling a little bit insecure, a little. He's like, but you exercise and here you've got this going on. What's happening with you, Jay? But that really happened. And my mum's sitting in the other. Yeah. Anyway.
Oh, I mean, that must have been really hard. That must have been really hard for you.
I just thought it was funny. I'm like, I've gotten used to people teasing me, and I'm 25 years old. So I'm just like, I shake it off now, but I thought I probably told it wrong. Not make it sound as funny as it actually was, but yeah, anyway, enough of man boobs. Sorry, go on. I suppose just to finish, just to round off that topic, if that's something that is bothering you or you're worried about, or it's worth going to your doctor, because as I mentioned before, there are other causes, and liver function as well is important to check. So yes, but also like some people just have very prominent pecs as well. I had a gentleman, but he actually just had very prominent pectoral muscles. So yeah, it's always worth double checking with your own doctor if you're not sure. I'll say that from now on. Thank you.
Very prominent pecs.
Very prominent pecs. We'll just use that. Thank you for that, Dr. Gemma. Really do appreciate it. So moving from that, and I do want to be mindful of your time as well. So I've got a couple questions to round off this conversation. I might have to bring you back at another time that's earlier for you and later for me. But I wanted to ask you about PCOS, or polycystic ovarian disorder or disease, that sort of thing, because my mum had it. She was told that she wasn't never able to have kids. For those women that might have it that don't know like how to treat it, is it treatable? What is it as well? How do you tell that you've got it? That sort of thing.
Yeah. So first up, I'm really glad you mentioned that your mum had it and was told that she couldn't have children, because I think that is absolutely shocking, and it's untrue. If you look at long-term data on women who have polycystic ovarian syndrome, in actual fact, they are just as likely to be able to have children as somebody that doesn't have polycystic ovarian syndrome. When you look at long term over the course of their reproductive lifespan, but that it can sometimes be more challenging. And the reason for that is because they may experience less frequent ovulation. So just to kind of highlight the point that your mum experienced when she was told that she couldn't have children, that's happened to a lot of my patients. And in fact, they've been quite blasé about not using contraception because they were told that they couldn't have children. And then, of course, they fall pregnant. So
that was my dad. He was like, all right, this is going to be great. And then all of a sudden, my older brother was born.
Yeah, exactly. So it's not true. And in fact, as I mentioned before, over the course of the reproductive lifespan, they're just as likely to have children, but there may be some difficulties. And the reason being is because with polycystic ovaries, what you experience is rather than having one egg released once a month, as you would normally expect, you get lots of small cysts that pop up on the ovary, and these little cysts are essentially they don't mature in the way that the normal corpus luteum matures as it's being released by the ovary. So you normally have that maturation process once a month, and then the egg is released, and that's basically how the whole cycle is perpetuated. And with polycystic ovaries, you get lots of these immature follicles that are just sort of popping up and trying to mature, but they haven't quite managed it. And as a result, there may not be as many of those eggs released. So you may have one released sort of every 6 weeks or every 8 weeks rather than every 4 weeks. And therefore, in one of the main symptoms that women with PCOS or PCOS will notice is that they have less frequent periods. It's also thought to be linked to insulin resistance in the body. So it's strongly associated with the increased risk of type 2 diabetes, which is also a condition of insulin resistance. And some women will notice that it's more difficult for them to lose weight, or it's easier for them to gain weight. They may notice that they are more have a higher propensity towards things like facial hair, sort of excess androgens in the body. And they may notice that there's an association as well between a low mood at times. Sometimes it can really affect self-confidence, especially if there's an increase in things like acne, which is, again, potentially there, in that case, hormonally mediated. So there's a lot of different symptoms. Most commonly, it will be related to less frequent periods, extra body hair, acne, things like that. But many people live with PCOS and don't even realize they have it. And it can actually affect up to 1 in 10 women. So it's much more common than people realize.
And what sort of brings it on?
Yeah, I mean, it can have its genetic risks, for sure. So there's a genetic predisposition, and it tends to be less easy to manage if you have a more Western diet and lifestyle. You may find yourself struggling with less frequent periods, depending on how you're able to manage your insulin resistance. So there are definitely environmental and endogenous factors. So things that you can do in your diet and lifestyle, but also your genetics can play a part as well.
So is it curable, or just more manageable?
Well, it's not something that you can necessarily cure, but it's much more common than you think. And there are ways that you can manage it with your lifestyle that will help it to have a far lesser impact on your life. In fact, I actually have two very good friends who this week published their book. One's a gynecologist and one's a nutritionist. They're a mother-daughter duo. And the daughter, the nutritionist, she actually lives with PCOS, and her mother, the gynecologist, also wrote the book. So it's called Living PCOS Free. And the idea is that you don't get rid of PCOS as such. There's no cure, but that doesn't mean that there's no hope. And the book outlines many of the strategies that you can use to help improve your PCOS. And of course, eating more plants is top of the list. There's lots of great research, loads of scientific studies in the book to highlight the importance of whole plant foods and helping to manage the insulin resistance that lies behind polycystic ovarian syndrome.
What sort of foods would you recommend that women eat? Like, what sort of plant-based foods would be the best in terms of managing PCOS?
Well, what you're aiming to do is having foods that help to maximize your insulin sensitivity, and eating lots of vegetables, whole grains, beans, lentils, chickpeas, fruits as well. These kinds of foods are really helpful for improving your insulin sensitivity and your insulin response. Soy products, soybeans, in the form of tofu or tempeh or miso, minimally processed soy, is also known to be really generally helpful for improving not only fiber and protein content of your diet, but also the phytoestrogens that they contain are useful for minimizing certain hormonal side effects and issues that you may experience. And that can also be useful for PCOS as well. So I'd suggest seeds as well, and nuts are great because they are a real powerhouse of proteins and healthy fats and certain minerals that are really helpful for helping to regulate your hormones. Selenium, for example, in Brazil nuts are brilliant. Calcium sources like tahini and apricots and broccoli and kale, cruciferous vegetables in general, are brilliant for many reasons, but hormonal regulation can be improved when you have all of the right nutrients in order to make these hormones in the most effective way. So take, for example, your thyroid hormone, you need to have enough iodine and selenium for that to work well. And you can get that from certain types of seaweed. Nori sheets, for example, are brilliant for that. Iodine fortified plant milks, for example, are great as well. So yeah, there's a number of different foods that can be helpful.
I'm going to have to bring you back on again, Dr. Gemma, and continue this conversation. I've got so many more questions for you, but the final two questions that I do have for you, just to round off this conversation, what do you love the most about yourself and your story?
Wow. Well, it's interesting because we haven't really talked about my story as yet on this podcast, but what do I love about my story? I love the fact that I am where I am. And I think, many of us experience things that give us heartache, that give us cause for feeling like, why me? I really wish this hadn't happened. I really didn't want to have to have experienced this. But at the same time, these struggles are really what help us to move forward in our journey towards understanding ourselves and the world better. And they can bring so much compassion with them as well, so much mutual understanding of what it's like to be human. So I love the journey and all its. I love about myself. Well, I believe I am. That's going to sound really corny, but I am love. I know we all are. At our core, that's what we all are. And we have lots of different layers to ourselves. We're like onions. We've got lots of layers, and lots of things that make us different from each other. But at our core, I believe that we are love, and I think that's what I'm most proud of. I think that's what I'm most proud of about all humans. And hopefully we can all begin to see that a little bit more as time goes on.
Well, I have loved this conversation, to be honest with you. And I know we didn't touch too much on your story. I promise we'll do that another later date. And I promise to do that very beginning. And we got snuck on something else. I apologize for that. It's like a very wide-ranging conversation, the first one. But yeah, definitely going to hopefully have you back on if you're open to that. But this is my final question for you, Dr. Gemma. It's my all-time favorite question. I love asking all my guests at the very end. It is a hypothetical one, but I want you to imagine with me for a moment that you've been able to reach the age of 100. All your friends and your family have decided to put together a film for you of everything you've ever said and everything you've ever done. Don't ask me how in the world they got all that. We'll just call it magic for the sake of argument. But they've been able to get it and show it to you on your 100th birthday. What do you want that film to say and to show about your life?
Wow. I would like for it to say that she loved, and that she loved her life, and that she was able to achieve what she needed to do in this world to help other people connect to the best part of themselves. That's it, really.
It's a good send-off message for people. I like it. Thank you so much, Gemma, for staying up this late and for sharing all your wisdom and your advice and a little bit of your story. We'll get to the other side of your story the next time, but thank you so much for joining me today on the Storybox podcast.
Thank you so much, Jay. I've really enjoyed it.